Most people still believe that lowering blood pressure means resigning yourself to long, exhausting walks, tasteless, restrictive meals, and a growing lineup of pills lined up beside your morning coffee. But after more than 20 years as a cardiac surgeon, after opening chests, after physically holding a human heart in my hands, I can tell you something that may stop you in your tracks for a moment. That picture is outdated. Not slightly outdated, dangerously outdated. Because there are three very specific actions you can do in just 10 minutes that most cardiologists never even mention in the exam room. They are backed by clinical research. They cost absolutely nothing. And after the age of 60, they often work better than the standard advice you've been given for decades. Stay with me here, because what I'm about to show you doesn't just help. It changes the entire way you understand blood pressure. And once you see it, you can't unsee it. By the time you're staring at numbers like 140, 150, 160 on that cuff, something important has already been happening quietly inside your body for years. No warning, no pain, no signal. High blood pressure doesn't knock on the door. It doesn't ask for permission. It simply goes to work, silently, minute after minute, day after day, pressing against your artery walls with every heartbeat. And over time, that pressure begins to wear things down. Your heart, your kidneys, your brain. That's why we call it the silent killer. Not as a dramatic phrase, but as a literal description of what's happening inside your body right now. Now here's the part that, frankly, frustrates me as a surgeon. We've been treating this problem backwards. A patient walks in with elevated blood pressure. What happens next? A prescription is written, sometimes 2, sometimes 3. They're told to watch the salt, try to walk more, and sent home. And that's it. No one sits them down and explains what's actually happening inside their arteries. No one shows them what they can do, in just 10 minutes a day, to directly influence the root cause. Now listen carefully. I am not against medication. Medication saves lives. I've seen it. But pills manage numbers. They do not restore elasticity to stiffened arteries. They do not retrain your nervous system to calm itself. They do not correct the underlying dysfunction that develops over decades. That requires something different. And this is where everything begins to shift. Because after 60, your body changes in a very specific way. Your arteries begin to lose their elasticity. Imagine a garden hose. A new hose bends easily, expands under pressure, adapts. But an old hose, it becomes stiff, brittle, resistant. The same water now creates far more pressure. That is exactly what's happening inside your blood vessels. Same blood, same heart, but a completely different response. And suddenly the advice you've heard for years, walk more, eat less salt, while not wrong, is no longer enough. Not at this stage. Not for this problem. Your body now needs something targeted, something precise, something that speaks directly to what has changed. Let me show you what's actually happening inside you. Because once you understand this, everything else begins to make sense. Your artery walls are made of smooth muscle and elastic tissue. When you're younger, they expand effortlessly when your heart pumps and snap back like a rubber band. But over time, decades of pressure, stress, and wear begin to take their toll. That elasticity fades, the walls thicken, they stiffen, and a stiff artery means higher pressure, no matter what else you do. Full stop. Now here's something that might surprise you. Regular cardio, walking, cycling, swimming, it's excellent for your heart, but it does not directly target arterial stiffness. It raises your heart rate, improves endurance, but it does not specifically retrain those artery walls to expand and relax the way we need them to. And this is exactly where most conversations stop, right at the surface. But this is where the real solution begins. Have you ever wondered why two people the same age, same weight, same diet, can have completely different blood pressure readings? It's not luck. It's not genetics alone. In most cases, it comes down to the arteries, their flexibility, their responsiveness. And here's the good news. That's something you can train. Now what I'm about to show you may look almost too simple. So simple, most people dismiss it at first glance. Isometric exercises. You're not running, you're not lifting heavy weights, you're barely moving. A wall sit, a plank. Holding still while your muscles work quietly underneath. And yet, the research behind this is remarkable. A 2023 meta-analysis published in the British Journal of Sports Medicine, reviewing over 200 studies, found that isometric exercises produced the largest reductions in blood pressure compared to any other form of exercise. Not cardio, not weight training, isometrics. For adults over 60 with elevated blood pressure, the average reduction in systolic pressure was around 10 points. Pause for a moment and let that sink in. 10 points. That's the equivalent of adding a second blood pressure medication for many patients, without side effects, without cost. So how does something so simple create such a powerful effect? Here's the mechanism. When you hold a wall, sit, or plank, your muscles contract and stay contracted. This temporarily restricts blood flow. Then when you release, blood rushes back in. Your vessels expand rapidly. And over time, that repeated cycle, restrict, release, expand, acts like physiotherapy for your arteries. They relearn flexibility. They become responsive again. Here's the protocol. 6 minutes total. 2 minutes of wall sit, back against the wall, thighs parallel to the floor. Hold. Breathe normally. Then 2 minutes of plank, forearms down, body straight, core engaged. Then finish with 2 more minutes of wall sit. That's it. 6 minutes. No equipment, no gym, no excuses. You can do it in your living room, in your pajamas, before your morning coffee. Now, important pause here. If you're new to this, start with 30 seconds. Build gradually. Listen to your body. If you feel chest pain or dizziness, stop immediately and speak with your doctor. But for most people over 60, this is not only safe, it's extraordinarily effective. Now once those 6 minutes are done, we move to something that looks even simpler and works even deeper. 2 minutes. Controlled breathing. And I want you to stay with me here, because this is not relaxation breathing. This is targeted neuroscience. Your body operates in 2 modes, fight or flight. Your sympathetic nervous system, the accelerator, heart rate up, blood pressure up, vessels constrict, and rest and digest. Your parasympathetic system, the brake, heart rate slows, pressure drops, vessels relax. Here's the problem. Most people over 60 with high blood pressure are stuck with their foot lightly pressing the accelerator all day, even at rest, even while sitting quietly. The system never fully powers down, and that constant low-level activation keeps pressure elevated around the clock. Now here's where it gets fascinating. The vagus nerve. This is your direct line to the brake pedal, and you can activate it deliberately using your breath. Here's how. Inhale through your nose for 5 seconds. Exhale through your mouth for 5 seconds. That's 1 cycle. 6 breaths per minute. Do it for 2 minutes. Eyes closed. Sitting upright. This is called resonance breathing. And at this exact rhythm, your heart rate and blood pressure begin to synchronize with your breath. Your vagus nerve activates. Your vessels relax. Your system shifts into recovery mode. Clinical studies, including randomized controlled trials, show that consistent practice over 8 weeks can reduce systolic pressure by 8 to 10 points. Again, pause and consider that. 2 minutes, sitting in a chair, and the effect stacks on top of the isometrics you just did. Now we move to the final piece, and this is where most people underestimate the impact. You're going to drink water, but not the way you normally do. Dehydration and high blood pressure are directly linked. This is well documented in research. When you're dehydrated, your blood becomes more concentrated, thicker. Your vessels constrict to compensate, and pressure rises. After 60, your thirst signal becomes unreliable. You can be significantly dehydrated and not feel it at all, which means many older adults are living in a constant state of mild dehydration without realizing it. But here's the part almost no one talks about. It's not just how much you drink, it's how you drink it. Gulping water quickly triggers a mild sympathetic response, a stress signal. Your body reacts, but slow, deliberate sipping does the opposite. It reinforces parasympathetic activation. It keeps your system calm. So in the final 2 minutes, take about 450 to 500 ml of water and sip it slowly. 1 small sip every 10-15 seconds. No rushing. What you're doing is locking in the calm state you just created. extending it, reinforcing it, and at the same time, rehydrating your blood, reducing viscosity, reducing resistance, reducing pressure. Now let's pause for a moment, because this next part matters more than most people expect. Consistency. Not intensity, not perfection, consistency. The most effective strategy here is something called habit stacking. You attach this protocol to something you already do every day. Brushing your teeth, making coffee, sitting down for breakfast. The moment that action ends, you begin your 10 minutes. No decision, no negotiation. Track it. Simple calendar. 1x per day. Build the chain and protect it. Now let me be very clear about the evidence, because there's a lot of misinformation online. Isometric exercise, supported by a 2023 British Journal of Sports Medicine meta-analysis of over 200 studies. Strong evidence, resonance breathing, multiple randomized controlled trials, established vagus nerve mechanism. This is physiology, not theory. Hydration, consistently linked to blood pressure regulation in clinical research. What does the evidence not show? That this replaces medication in severe cases. If your systolic pressure is above 160, this is a complement, not a substitute. Work with your doctor. That is non-negotiable. Now before we close, let me save you from the most common mistakes. Holding your breath during isometrics. This spikes pressure. Rushing the breathing destroys the mechanism. Gulping water cancels the calming effect. Doing too much too soon leads to quitting and missing days and thinking you failed. You haven't. You simply start again the next morning. Now take a step back for a moment and really consider what you've just learned. A 10-minute protocol targeting 3 root causes: arterial stiffness, nervous system dysregulation, chronic dehydration. Pharmaceuticals typically target 1. This targets all 3 simultaneously. I've spent over 2 decades in operating rooms, seeing the consequences of unmanaged blood pressure, strokes, heart failure, kidney collapse, and I can tell you with certainty, these 10 minutes matter more than they appear. Your body still adapts. Your arteries still respond. Your nervous system still recalibrates, but only if you give it the right signals. Starting tomorrow morning, 10 minutes. That's the investment. The return is measured in years. So here it is. 6 minutes isometrics, 2 minutes breathing, 2 minutes slow sipping. Stack it, track it, stay consistent. Give it 6 weeks, and tell me, which part surprised you the most? Because often, the simplest things are the ones we've been overlooking all along.